Today I'm going to be administering the 9 a.m. meds for my patient. The first thing I want to do is check the doctor's orders that he has ordered for me to administer these medications. So I'm going to check that on my and compare it to my MAR. So I see that, and then I'm also going to look at my MAR. Once I verify that everything in the doctor's orders is correct, I'm going to look at my MAR to see what's the patient's name. So I see the patient's name is Joanne Smith. I want to see if she has any allergies as well, and I see that she has no known allergies. I also want to see her diagnosis. Her diagnosis is a CVA, and she also has diabetes mellitus. And I also want to see her date of birth. So I see that her date of birth is October 18th, 1955. And so I've checked that, and now I'm gonna check, she's a female, so now I'm gonna check which 9 a.m. meds I'm going to be administering this morning. So the first 9 a.m. med is Lipressor. I see I have Lipressor on here and my MAR. And then the next 9 a.m. med I have Glucophage, 500 milligrams. I see that the next 9 a.m. med I'm going to be administered is Digoxin at 9 a.m. And then Valium is a PRN medication, 5 milligrams at 9 a.m. for her anxiety if she was experiencing any sort of anxiety attack. So now my first check is going to be me checking what I have on hand. Now I'm going to be performing hand hygiene before I take out any medications. Okay, so I'm going to open my cart and see my first medication is Lipressor. So I have Lipressor on hand. I'm going to check my patient's name, Joanne Smith, date of birth. I see her date of birth is correct. And I'm also going to be looking at the expiration date to see if the medication has not expired. So I see the medication is Lipressor on my MAR, and I have Lipressor in hand. The dosage is 100 milligrams. I have 100 milligrams. I see that the time I'm giving it is 9 a.m. So I am still within the time limit. It's 9:10 in the morning, and the route is going to be PO. So I know I have pills in here, so that's going to be the route. And I'm also going to be checking to see the reason. I'm going to be noting that the reason I'm giving Lipressor is because Lipressor will help reduce her risk of getting a CVA, another CVA. So I note that, so that's the reason. And I know that the patient does have the right to refuse the medication if she were not want the medication. So I have that one. So the next 9 a.m. med I'm going to pull out is Glucophage, 500 milligrams. I see I have Glucophage. That's a medication, 500 milligrams. I see that's the dosage. The reason I'm giving Glucophage is because the patient has a diagnosis of diabetes, so I know this is going to treat her type 2 diabetes. I see that it has not expired, and I also see that the route is PO, so I know I have pills in here, and I'm still within the time limit to give this medication because it's still 9 a.m. in the morning and it's a 9 a.m. med. And I know that the patient does have the right to refuse. So yeah, I see her name, date of birth, everything is correct, and it has not expired. So I'm gonna put that there. Oh, and before giving Glucophage, I also want to assess the patient's blood sugar to see that I'm okay to give that medication. So the next medication is Digoxin. I have Digoxin on hand for Joanne Smith. I see her name is correct and her date of birth is correct. The medication is Digoxin, like I said, and then the dosage is 0.125 milligrams, and I have 0.125 milligrams. I know Digoxin will help reduce the workload of her heart, and this will help her treat her to not get another CVA. so it'll reduce her heart rhythm a little bit. And then I know that prior to administer digoxin, I also want to assess the patient's apical pulse for a whole minute, and also take her blood pressure before giving the medication. So that's the reason. And then it has not expired, and I know it's PO, so I should have some pills in here. And also, I also want to know that I'm still within the time limit to give this medication, which is 9 in the morning. So I'm still within the time limit. And then also, I know that the patient does have the right to refuse her medication of digoxin. So her next medication is Valium. So I see it's for Joanne Smith. I have Joanne Smith. Her date of birth is correct. I see that the medication has not expired, and I know Valium is going to help treat her anxiety if she were to have anxiety. So that would be the reason for me to give her. I know that the dosage is 5 milligrams. I have 5 milligrams on hand, and this is a PRN medication. I'm still within the time limit to give the medication, which is 9 in the morning, and the route is PO, so I have pills in here. And like I said, this is a PRN medication for Valium, so I would first assess my patient prior to giving Valium. So I would check her vital signs and see if she was experiencing any sort of signs and symptoms of anxiety. That would give me the reason to administer Valium. Otherwise, I would ask the patient if she was having any sort of signs and symptoms of anxiety and if she would want the medication. But if she didn't, I would not administer, because she does have the right to refuse. And this is a PRN medication as well. So now I'm gonna do my second check before going into the patient's room. The first 9 a.m. med, again, starting from the top, is Lopressor. So I have Lopressor on hand. That's my medication. I checked the patient's name, Joanne Smith, date of birth is correct. I also checked the expiration date, that it has not expired. So I want to check the dosage, 100 milligrams, 100 milligrams, PO, so I have pills. And I also know that I am still within the time frame to give the medication. And the reason I would give Lopressor is to help her reduce the risk of getting another CVA of her diagnosis. And then she does have the right to refuse the medication as well. So the next medication I'm gonna do is the Glucophage again. So I have Glucophage on hand. That's my medication. I see that it's for Joanne Smith. That's my patient's name, and I know her date of birth is correct. I also want to check the dosage is 500 milligrams. I have 500 milligrams on hand. I see that the medication has not expired. I know that the route is PO, so I have pills in here. And she does have the right to refuse the medication if she didn't want to take it. I'm still within the time frame to give the medication, which is 9 a.m. It's 9:10, so I can still administer the medication. I know Glucophage, the reason I would give it is because she has a diagnosis of type 2 diabetes, and this will help treat her type 2 diabetes. And I would first have to take her blood sugar before giving Glucophage to see that I'm still going to be administering it. And she does have the right to refuse as well. The next medication is digoxin. I have digoxin right here. That's a medication for Joanne Smith. I have Joanne Smith's medication, and her date of birth is correct. The dosage is 0.125 milligrams. I have 0.125 on hand. It has not expired, and the reason I'm giving digoxin would be to help her heart rhythm, and this will reduce the risk of her getting another CVA as well. And also, prior to administering digoxin, I want to make sure I take my patient's apical pulse for a whole minute, and also her blood pressure. So I'm still going to be administering the medication. And then I know she does have the right to refuse. So she does have the right to refuse. And then PO, that's the route. So I know I have pills in here. And then the time frame, I'm still within the time frame to administer the medication, which is 9 in the morning. And the next medication I have is Valium. I have Valium on hand for Joanne Smith. I have Joanne Smith right here. I see that's her name, and her date of birth is correct. I also want to look at the medication name. So I have Valium, and the dosage is 5 milligrams, and I have 5 milligrams on hand. I see that it has not expired, and this is a PRN medication. So I would have to first assess my patient before administering Valium. And I know the reason I would give Valium would be for my patient's anxiety. So if she were experiencing any signs and symptoms of anxiety, or me assessing, if I notice that she does have some symptoms of anxiety, then I would administer the medication, since it is a PRN medication, and I'm still within the time frame to administer it, which is 9 in the morning, and then it's PO, so I have pills in here, but she does have the right to refuse. Okay. So those are the 4 medications I'm gonna be administering. So now I'm gonna close my cart, perform hand hygiene before entering the patient's room, and now my third check is gonna be in the patient's room. So I'm gonna knock, take my med cart in here with my patient. Hello, my name is Carla. I am a student nurse. I'm going to be administering your 9 a.m. medications today. Is that okay? Okay, could you please tell me your name and date of birth? And do you have any known allergies? No? Okay. I would check my patient's wristband to see her name and date of birth matches, and also would check if she were having allergies or an allergy band. Okay. So I'm gonna close the curtain. I'm gonna have my patient sit up. How are you feeling today? So I would make sure I assess my patient, and then have her sit up. So, and this is the moment I would take vital signs for my patient. I would ask her if she's experiencing any signs and symptoms of anxiety. I would take the apical pulse for a whole minute, and I would also check her blood sugar, and I would take her blood pressure as well, because some of the medications I'm going to be administering needs me to assess my patient prior to administering it. So that's when I would do it. And I assess the patient, and she is all fine, so I know that I'm going to be administering the medications, but she did deny having any signs and symptoms of anxiety, and I did take vital signs, so she does not need the Valium for right now, so I'm going to be putting that away. Okay, and so yeah, and now I'm going to do my third check in the patient's room. So perform hand hygiene again, and then so I have Lopressor. I have Lopressor on hand. That's my medication. I have 100 milligrams. I have 100 milligrams for Joanne Smith, and her date of birth is correct. I know the route is PO, so I have some pills in here. And also, I am still within the time limit for me to administer Lopressor, which is 9 in the morning. And I know that my patient does have the right to refuse, but she says she wants to take her Lopressor. And the reason I am giving Lopressor is because this will help reduce the risk of her getting another CVA. So I would, and I know the route is PO, so I have pills in here. So I should have 1 pill in my medication cup when I put it in there. And I see that the medication has not expired. So I have 1 pill. in here. Okay, Miss Joanne Smith, this is your Lipressor, and this will help treat reduce the risk of you getting another CVA. Okay, so I would give her the water first and then give her the Lipressor. But yeah, I would throw this away. Okay, the next medication I have is Glucophage. So I have Glucophage, and like I said, I already assessed my patient, her blood sugar, prior for me to administering the medication. And I have Joanne Smith, date of birth is correct, as the MAR says. I know the medication is Glucophage. I have Glucophage in hand. I have 500 milligrams. I have 500 milligrams on hand. The route is PL, so I have pills in here. And the time, I'm still within the time limit to administer the medication, which is 9 in the morning. I know Glucophage will help treat my patient's type 2 diabetes, because she does have a diagnosis of that. So I'm going to, and I see that has not expired. So I want to make sure that I only have one pill in my medication cup. And like I said, the patient does have the right to refuse her Glucophage, but she wants to take it, so I'm going to be administering it. So here you go, Ms. Joanne Smith. This is your Glucophage, and this will help treat your type 2 diabetes. And so I'll give you the water, and then okay, the next medication is Digoxin. I have Digoxin on hand. That's the medication. It's for Joanne Smith. I have Joanne Smith. I have her date of birth. I have her date of birth here, and it's correct. I see that the route is PL, so I have pills in here. I know it's 500 milligrams. I see that it's 0.125 milligrams, and I have 0.125 milligrams right here. And like I said, it's PL, so I have pills in here. And I'm still within the time frame to give the medication. And before giving Digoxin, I did assess my patient's apical pulse for a whole minute, and I did check her blood pressure to see that it's still okay for me to give the medication, and it is. That's why I'm administering it. And I know Digoxin will help. The reason I'm giving it is because it will help with her heart rhythm, and it will be beneficial for her to not get another CVA because it'll reduce the risk. So, and I know she does have the right to refuse, but she did want the medication, so that's why I'm administering it. So yeah, and I see the medication has not expired, so I'm still within the time limit. And like I said, the dosage is correct, so I'm gonna make sure I only have one pill. Okay, here you go, Ms. Joanne Smith. This is your Digoxin, and this will help reduce the risk of you getting another CVA, as well as gonna help with your heart rate. So I would give her the water and the medication. So I already educated my patient on all the medications that she was taking. Okay, Ms. Joanne Smith, I want to make sure that, like I said, I did assess my patient, so I'm not going to be giving her Valium. That's why I put it away, because her vital signs were all correct, like all within normal. And so she did tell me she did not want to take her Valium because she wasn't experiencing any signs or symptoms of anxiety. Otherwise, I would have to administer if she did have them. All right, Ms. Joanne Smith, is there anything else I can do for you? Okay, I'm just gonna give you the call light in case you need anything. I wanna make sure that the patient is still sitting up so the pills can go into her stomach. I wanna make sure that the bed is all the way down, because a lot of the side effects of the medications are hypotension, or also she can become dizzy, so I don't want her to have any accidents falling out or anything else. And I also want to make sure I let her know that I'm going to be coming back and assessing her in 15 minutes because of the metformin, the glucophage, and also 30 minutes for the other medications as well. And so yeah, I'm gonna give her a call, like I said, put the rails up and make sure she's comfortable. And now I'm gonna open the curtain and then wash my hands. And then outside the patient's room, I'm gonna document what I did, which was give the 9 a.m. medications. I'm gonna document I gave Lopressor. I'm gonna document that I gave glucophage, and I'm gonna document that I gave digoxin, but I'm not gonna document that I gave Valium because I did not give the Valium. And I wanna make sure that everything is covered because to maintain patient's privacy. And yeah.